The government of India has sent advisories across several states of the country reporting an increase, a surge in the COVID-19 cases, and there's also hospitalization. This comes with an alert that with the festive season around the corner, the situation may worsen. People need to watch out and be prepared. This time also watch around you because there is a reinfection that's also becoming common and worrying. Hospitalizations have increased. So is it Omicron? Is it a subtype causing this surge, or could there be more to this? My colleague Sneha Murdani gets you this very important report. Take a look. US President Joe Biden, Congress President Sonia Gandhi, her daughter Priyanka Gandhi Vadra. What is common in all of them? They all reported the reinfection of COVID-19 literally weeks after they recovered from the first bout. In the case of the American president, a rebound infection that occurs within a few days of recovering. National capital Delhi is among a handful of other cities in India that are witnessing a surge in the cases of COVID-19. The worrying bit is that deaths and hospitalizations are also increasing.
10 days before we used to have 5 to 7 admission per day, but now we are definitely getting more than 10 admissions per day. Per day admission around 13 to 15, but majority of these patients don't require ventilatory support or ICU support.
As per Delhi government's corona application, of the 9,416 COVID beds, 590 are occupied. Of the 8,885 oxygen beds, 562 are occupied. ICU hospitalizations have also increased. 205 patients of COVID are in the ICU against a capacity of 2,129 beds. 66 out of 1,194 ventilators are in use. A 19-year-old paramedic has died due to COVID-19 in Delhi. Abhishek Malviya, the medical student at Delhi's All India Institute of Medical Sciences, was suffering from COVID and swine flu, causing a panic. But experts say the possibility of a repeat of the horrid summer of 2021 is unlikely. But will there be a large wave of infections, the kind that was started by Omicron in India in January this year?
The hospitalization that we are observing with the present waves of COVID-19 are mostly people who have other health conditions that happen to worsen with the onset of COVID-19. It's unlikely that the current trend will end up in a large wave like we saw in January, because it is mostly, almost exclusively, 97% constituted by Omicron sublineages.
However, this assurance is based on the fact that there is no new variant of the concern detected in India and outside. It is still Omicron and its subtypes that are at work.
India's genomic sequencing has not identified any new variant. The INSACOG's regular bulletins have only shown what is expected. There are no new variants that have been reported so far in India or elsewhere in the world.
Data, however, shows that the surge we are witnessing now is different from the surge in April. For example, on 26th April, when Delhi reported around 1,200 cases, the number of people hospitalized stood at 114 on the 8th of August. When Delhi reported almost the same number of cases, the hospitalization stood at 490.
Novel coronavirus and its forever mutating variants have their own ways of throwing surprises at us. And that's the reason why experts say that it is best to not leave anything to chance. In fact, there could be a new variant just lurking around the corner. Currently, Omicron is known not to cause severe infection in most people. And the people in hospitals right now are the ones who are immune compromised. Well, even almost after 3 years of the pandemic, our best bet continues to be COVID-appropriate behavior, following COVID protocol until the time variant-specific vaccines are developed. With inputs from Pankaj Jain in Delhi, Sneha Murdani for India Today.
So in the month of August itself, there has been a rise in hospitalization with regard to COVID. I want to take you through the numbers that we have right now. Now, the people in ICU are 98. This, remember, just when the month of August had started, which means people in the need of oxygen support specifically are at about 76. But people who have gone on ventilator with COVID-19 symptoms have been at least 10. This was just when August had started. 15 days later, the number has jumped. 186 people have been reported at the ICU. There are people in need of oxygen support that has also risen to 165, while there are people on ventilator that are at least about 19. So take a look at the numbers from just 1st of August, 15th of August right now. Sneha Mordani has got us these statistics. She's been speaking to experts as well. Sneha, there is COVID, there is swine flu. This is clearly also a festive season. What are the experts telling you? What do these numbers indicate? And you know, we're not trying to alarm our viewers, but we want to alert. What are the doctors telling you?
At the risk of sounding a little alarmist, let me also tell you that we've seen a surge in the month of April as well. But if you just do the comparisons, for example, I put out that data in this report that we just put out for our viewers. When the cases were hovering around 1,200 or so, then the number of hospitalizations are actually much lesser than what they are right now. In fact, the Delhi government Corona app gives out detailed figures of the number of beds, essentially ICU beds, and also the oxygen beds, and that has increased, and that really is a worry because the increase in cases is expected. But what is a little worrying is the manner in which the number of ventilator beds also in Delhi at least have gone up. Now, experts say that there is a possibility, because we'll not know until sometime until some time, that there could be in fact another variant. But right now, from the data that we have, it does appear that it's only the subtypes of Omicron. Looking at the nature of the fifth variant of concern and the manner in which it has behaved in different parts of the world, what is clear is that healthy people are not falling severely ill, and I think that is something that we all can sort of in a way take solace from. The 19-year-old case study in this report, Pooja, is of a patient who didn't receive a timely medical attention, and he was also suffering from swine flu as well. So that's a different case altogether. All in all, reason to be worried given the rise in hospitalizations and the rise in ventilator beds.
And watch out around you, because with the festive season, do not lose your guard. Ensure that you're taking all precautions, especially at least wearing a mask. Thank you so much, Sneha Mordani.